Okay, so Sid, over the years, you've had the opportunity to try your hand at golf.
Yeah, I've taken a swing or two and had a blast while doing so.
Yeah, would you call yourself a golfer now?
No.
No.
Not quite. In fact, I'm pretty sure most people who step foot onto a golf course take it to a whole nother level than I did. And it's not uncommon for many of those golfers to experience back pain either during or after playing. So 102.5 WBOC's Corey Phoebus recently learned about a program on Delmarva that works to target that pain so golfers can get back out on the course. He stopped by Excellence Physical Therapy in Lewis to learn more about it.
A round of golf can be enjoyed by yourself, with friends or colleagues, or even as a profession. Whichever way you enjoy the game, most golfers have one thing in common: back pain. How is it that a relaxing day can leave us in so much pain?
So low back pain in golf is one of the most common injuries out there. There's several reasons why. Some of the biggest reasons are lack of mobility in places where it's needed, especially through the thoracic spine or the trunk and the hips. So those two areas really need to be mobile through the golf swing. So if they're not mobile, then your low back has to have more movement through there, which can cause pain. And then also you need to have good stability or strength through your core and your glute muscles or your butt muscles through there. So when there's not enough strength through there, then some extra pressure can be placed on the low back through there.
Trevor is certified through the Titleist Performance Institute, or TPI, which is the leading educational organization to the study of the human body and how it relates to the golf swing. This allows Trevor to identify how any mobility or stability deficits affect your swing, how to improve it, and how to prevent future injuries.
One thing I really emphasize to a lot of golfers I work with is warming up properly too. So almost every golfer I work with swings to warm up. I try to get them to switch their philosophy of warm up to swing, not swing to warm up. With the idea of that is that you get your body ready for movement with different stretches or light strengthening exercises beforehand. Because they say the amateur golfer on average swings 60 full swings when they play a round of 18. So they probably don't need 60 full swings when they're warming up.
The reason Trevor is TPI certified is because it's his passion to work with and help athletes even if they don't have an injury. Preparing someone for the correct movements and making sure they have strength in those areas is a fantastic way to improve your swing and overall game.
For me specifically, it helped a lot because I was working on my golf swing and always coming into the same swing faults. So luckily I met up with Trevor and he put me through a few tests, and right away we could see what problems I was having in the golf swing and where we could attack to help my golf swing to improve it.
One of the many benefits of Aquacare is their ability to heal and treat while you are virtually weightless.
Aquatic physical therapy is great for a lot of people. The pool is at 92 degrees, so it's very warm, but it's a desensitizing environment. You know, so if you ever had a heating pad and placed it on your low back, that obviously feels good. Now imagine your whole entire body being in the pool, so it can really calm things down, but it also allows us a lot of movement that you may not be able to do on land when you're in pain in the pool. Because of buoyancy or flotation, your body weighs less essentially, so it's less strain on muscles. You can avoid some increase in pain you may have with a typical exercise while still getting the benefits.
Salvatore, the clinical director of Excellence Physical Therapy, also has a shared passion for helping people with injuries using the McKenzie method of mechanical diagnosis and therapy.
The unique aspect about the McKenzie method is that it takes into consideration postural awareness, right? It looks at a single exercise that really helps limit their pain and functional limitations, right? And so it enables them to be more self-empowered, right? Be able to take care of their own conditions.
A common misconception of the McKenzie method is most people think it only helps the spine. Salvatore assures us that this is simply not true.
These methods work with any joint in our body, right? So for knees, for example, you know, a lot of our patients come in with x-rays saying that they have arthritis or they have degeneration. And so what that shows, arthritis and degeneration, it's all normal, right? That's part of the aging process. But you can't really determine whether arthritis in a knee is really causing the pain that a patient is experiencing or the functional limitation that they have, right? And so, you know, by doing a really comprehensive examination and evaluation, we can see if they respond mechanically.
With Aquacare having 10 locations throughout the Eastern Shore, there's certainly an opportunity for you to take advantage of their incredible therapy programs, which are covered by insurance.
Now, Excellence Physical Therapy is considered Aquacare Physical Therapy's land-based division. If you'd like to read about both of them, go to delmarvalife.com.
And who's going to pass up a day in the pool?
Oh, no one.
See, there you go.